Assalamu alaikum. Welcome to Dermatology Journal Scan for March 2026. In psoriasis patients, comparing before and after treatment values of the neutrophil to high-density lipoprotein cholesterol as a marker of cardiovascular disease risk, Apremilast seems to show a favorable impact on the development of cardiovascular disease among psoriasis patients. From the Bad Beer Psoriasis Registry, Fan et al. Analyzed more than 3,000 psoriasis patients starting treatment with conventional systemic therapy and 300 patients starting with biologic as first-line systemic therapy. Their results showed a tendency for better clinical outcomes among patients starting treatment with biologics versus conventional systemic therapy, as reflected in better PASI score, better dermatology life quality index, shorter clearance intervals, and development of new mental and hepatic comorbidities. In a joint statement between the National Psoriasis Foundation and the International Psoriasis Council, the majority of psoriasis experts agreed that routine testing for latent TB infection is not required prior to or during the treatment of psoriasis patients with interleukin-17 or interleukin-23 inhibitors. However, the experts agreed that exceptions exist for specific patients and in certain clinical conditions, like in TB endemic areas of the world and patients on concomitant immunosuppressant medications. On the same topic, Toplo et al. Argue that interferon gamma release assay, also known as TB Gold test, is not enough for diagnosis of latent TB among high-risk population, and it should be coupled with chest X-ray. In a case series including 16 patients, Carmen et al. Demonstrated the high efficacy of interleukin-2 therapy for cutaneous squamous cell carcinoma with an 81% complete clearance rate even in patients who failed prior surgery. Based upon 9 included studies, a meta-analysis by Arrobian et al. Concluded that the addition of Desloratidine to isotretinoin in the treatment of acne vulgaris may be of benefit due to a decrease in histamine-driven inflammation and suppression of interleukin-6 and tumor necrosis factor alpha by Desloratidine. With a scarce knowledge about topical treatment for hidradenitis suppurativa, a phase 2 randomized clinical trial demonstrated the promising value of topical Ruxolitinib cream for stage 1 and 2 disease on the Hurley score. In this comparative study of effectiveness of biologics for pustular psoriasis, the anti-IL-36 Pustular showed higher efficacy in reduction of generalized pustular psoriasis physician global assessment and shorter hospital stay versus anti-TNF and anti-IL-17 biologics. Interestingly, the efficacy of both interleukin-17 and anti-TNF biologics for treatment of generalized pustular psoriasis was almost the same.